All right, dentists, we've all been there. The patient is in the chair, writhing in pain from a hot tooth. You've given them your best block. You've waited 10 minutes. You go to touch the tooth with your Explorer and they just jump out of the chair. The anesthesia isn't working. Your schedule is falling apart and you're getting really stressed out. If you've ever felt that sense of panic and helplessness, then this video is for you. A hot tooth can be one of the more stressful situations in clinical dentistry, but it doesn't have to be. After managing practices and dentists that have treated thousands of endodontic cases over the years, I've developed a predictable, step-by-step protocol that consistently works. So if you're ready to learn how to confidently and predictably numb up even the hottest teeth, stick with me. Because by the end of this video, you will have a complete battle-tested system to handle this situation with total control. Now, this entire system is built on a few key layers. First, we need to quickly understand the science of why these teeth are so hard to numb. Then I'll give you some simple tricks to make the standard injection more effective. And finally, for those stubborn cases, I'll walk you through the advanced injections and practical hacks that will guarantee profound anesthesia every single time. But first, let's quickly understand the enemy. Why are these inflamed teeth so resistant to our anesthetic? There are three main scientific reasons. First, the pulp is incredibly inflamed and hyperexcitable. This inflammation actually changes the resting potential of the nerve fibers, making them less responsive to our anesthetic. Second, the inflamed tissue has a lower, more acidic pH. This acidic environment can interfere with the anesthetic molecule, preventing it from effectively blocking the sodium channels in the nerve membrane. And third, this is why our standard inferior alveolar block can sometimes fail even when the patient's lip is numb. Inflamed teeth can have increased blood flow, which can carry the anesthetic away from the nerve more quickly, and they can even have accessory innervation that isn't covered by a traditional block. So knowing that, how do we make our standard injections more powerful? Well, here's a few simple, effective tricks. First, consider buffering your anesthetic. You can add a small, specific amount of sodium bicarbonate to your lidocaine carpule right before you inject, and this raises the pH of the anesthetic solution, which allows it to have faster onset and a stronger, more profound effect in that acidic environment. Second, don't be afraid to use a higher concentration or volume. If your initial lidocaine block isn't working, re-injecting with articaine, which has a higher concentration and better bone penetration, can often totally do the trick. And third, always focus on your injection speed. Injecting very slowly over a full 60 to 90 seconds can sometimes allow the solution to diffuse more effectively into the tissues and is significantly more comfortable for the patient. Now, what if you've tried all that and the tooth is still hot? Well, this is where you need to have your advanced injections in your back pocket. The first and most common is the intraligamental or PDL injection. Now, using a high pressure syringe, you can directly inject anesthetic into the periodontal ligament space. This is a great tool for getting profound anesthesia on a single tooth, but the effect can be short-lived, so you need to work efficiently once you've given it. For mandibular molars, one of the more predictable techniques is to follow up your block with a buccal or lingual infiltration of articaine. Because articaine diffuses through the bone so well, a simple infiltration on the buccal of a hot mandibular molar off, even after a good block, can be the final piece of the puzzle that gets the tooth completely numb. And if that doesn't work, it's time to move on to the intraosseous injections. You can use a system like X-tip, where you create a small perforation through the cortical plate, and then you deliver the anesthetic directly into the cancellous bone right next to the apex of the tooth. This technique is incredibly effective because it bypasses all of the soft tissue and delivers the anesthetic right where it needs to go. It's my go-to backup when a block and infiltration fail. And finally, as a last resort, if you're doing an endodontic case, you of course can try the intrapulpal injection. Now, once you've gained access to the pulp chamber, you can directly inject a small amount of the anesthetic into the pulp tissue itself. Now, the injection itself is briefly pretty painful for the patient, but it does provide instant, profound anesthesia and allows you to complete the procedure very comfortably. This all leads to the practical hacks that experienced dentists use to put all of this together in a predictable sequence. So first, you start off with a good, slow, inferior alveolar block using lidocaine. And if that's not enough, after you've confirmed the lip is numb, you can follow up immediately with a buccal infiltration of articaine. Then test the tooth. If it's still not profoundly numb, don't hesitate. Just go straight to your either PDL or intraosseous injection. So block, infiltrate, intraosseous. This sequence will get 99% of hot teeth completely numb. And another great hack is to pre-medicate the patient. Having them take 600 to 800 milligrams of ibuprofen an hour before the appointment can reduce the pulpal inflammation. It makes the anesthetic more effective from the start. Now, managing the patient's mindset through all of this is just as important as the injections themselves. You have to manage their expectations. Before you even start, you need to say something like, "Mrs. Jones, because your tooth is so inflamed, it can be a little more stubborn to get numb. So we're going to be very patient. It might take a few extra steps and a couple different types of injections, but I promise you we will not start the procedure until you are completely comfortable and don't feel a thing." When you frame it this way, you're not failing when your first injection doesn't work. You're simply proceeding with your protocol, just as you said you would. So it builds trust, and for your own stress, the key is just don't panic. A hot tooth feels like an emergency, but it's really not. The worst thing you can do is rush. Just stay calm and follow your protocol step by step. So to recap, hot teeth don't have to ruin your schedule. Start by understanding the science, enhance your standard blocks and buffering and articaine, and always have a backup plan ready to go. It's like your triple cocktail of block, infiltration, and intraosseous. When you have a predictable protocol, you can manage any hot tooth with confidence and control. So if you have found this advice helpful or valuable and you want more straightforward, no-nonsense strategies to improve your practice, make sure to hit the subscribe button below. I'd love to hear from you in the comments. What is your go-to technique when a standard block fails on a hot tooth? Let's keep working together to make dentistry fun, fulfilling, and rewarding. Subscribe so you don't miss the next strategy, and I'll see you soon.